Okay, well, I will get started, and if others join, then that is okay. Um, so welcome back. This is the last week in our course, so congratulations on wrapping up what could have been your first week at National. I know for some of you, maybe you've taken some previous courses. I can't guarantee that other courses will be in this format. This is a 1.5 credit hour class, so you can expect other classes to be slightly more intensive, but overall 4 weeks goes by quickly no matter what course you're in. And so I hope the time that you had to complete activities was enough. If there's any feedback that you have for the course, both formal and informal, I'm very open to it. I wanted to remind all of you to complete the evaluation for the course, which should have come to you via Blackboard. That did not come from me, that came from the university. And I would just like to encourage you and remind you to send that or complete that evaluation as soon as you can. And also, more informally, if you would like to shoot me an email, and this is totally optional, but things you liked about the course, things you didn't like, activities that you found valuable, ones that you didn't. I'm really open to hearing those suggestions. This is actually my first time teaching this course, so and so I would love your feedback if you're willing to share. And so on the topic of evaluation, it is something that we need to do in public health all the time. And I wanted to distinguish between research and evaluation. In our curriculum, if you are in the mental health track and the health promotion track, you will take a course on public health program evaluation. If you're in the health admin track, you will actually not take a course on evaluation. And so I wanted to talk about evaluation versus research because particularly in healthcare settings, we often want to do evaluation exercises as opposed to research. And so I want to make that distinction as you go forward. And also, evaluations are often easier to conduct on a small time scale. Research, it's hard to do a project in 6 months in research. It's not impossible, but generally speaking, we allow for at least like a year or so to complete our research project. Evaluation can be a more ongoing process and can be on relatively short timescales. And so as you're thinking about doing research as part of your capstone or your experience over your 2 years, evaluation may actually be the way to go in terms of getting involved in doing research-like work, especially if you're already placed at an organization or you already have access to programs or activities that you might be able to help evaluate. Because just about every setting requires additional evaluation to determine, is what we're doing actually working? So in the case of evaluating a course, we want to make sure, yes, that you're satisfied with the technical aspects and things like that. But ultimately, I would want to evaluate, what was learned, what was gained from participating in a course or in a program. And so really everything we do, if we want to know if it's actually working, we need to do some sort of evaluation. So that may seem obvious to you, but the distinctions between research and evaluation are somewhat subtle. And so I wanted to talk a little bit about some of those differences. So evaluation and research are both ways that we develop an evidence base on a particular issue or a particular question. The difference is that evaluation is used to determine if a specific project or a local intervention or program is effective. So if I'm implementing a program at a hospital, let's say that we've had an issue with expired medications being wasted, and we want to reduce our excess costs. It also presents patient risks because the medications are expired, and so I want to implement some new process to avoid having expired meds, which are a waste, and they're also potentially putting patients at risk, or they may be less efficacious. And so I may, on my floor or my unit or my hospital setting, put together some sort of new process and see if that improves the rate at which you're experiencing that bad outcome of having expired meds and waste. So you can measure that in terms of quantity, you could measure that in terms of cost, any number of things. So that's very much like a research project where we're implementing some new idea or intervention, but the goal is really specific to that setting. And so research is based on drawing samples to generalize to larger populations. So if I was being really ambitious about it, to really call that research, I would probably want to see if this particular strategy worked across multiple settings and could suggest that this is the way to do effective, stocking and distribution of medications. But each setting is also probably quite different. So that might be not necessarily even the goal. You may be simply trying to figure out how to do a better job within your unit. So research, again, is based on the intent of being able to generalize to larger populations. It doesn't have to be the entire world, but for example, if I'm doing a research study on asthma and I'm looking at the effects of air pollution exposures on risk of asthma, I'm probably doing that not just to figure out what's happening locally. I'm probably trying to generalize to the entire US to determine if maybe our standards for emissions are not enough to protect human health, if there's some way to provide education to the public, so maybe they avoid going outside on days where the air pollution levels are very high, which we know happens in California every once in a while. And last year in Seattle, we also had some pretty bad days. But that type of research or that type of question would probably be the goal of publishing something in the academic literature and to a broader audience. Okay, so that's really a subtle difference, but it's important because the intent is different and some of the process that we go through is different. And why I'm mentioning evaluation now is that some of you very well may want to participate in evaluation and have no interest in research. I can't imagine having no interest in either, because to make programs good or more effective, we always need to do one or the other. And some of you have probably been involved in these types of activities in different settings, whether you knew it or not, or at least as a participant, as an evaluator, completing a survey or something like that. So not to beat a dead horse, but I just want to go through kind of the comparison between evaluation and research, kind of line for line here. So for evaluation, the goal is to improve the effectiveness of a program. You can think of it as a project or a setting. Research, the comparable goal would be to create new scientific knowledge. Evaluation, we're making recommendations for improvements to an existing program. For research, we'd be generalizing from a sample to a larger population. Most importantly, in terms of dissemination of the two different types of activities, in evaluation, we're really trying to provide useful feedback to either an organization, a hospital, a community, but it really doesn't necessarily extend beyond that. And then for research, we are attempting to draw conclusions, scientific conclusions. And whereas in the case of evaluation, we report out to stakeholders, participants, so on, In research, we would usually report that out by some form of publication. Evaluation uses data and facts, doesn't necessarily have a specific hypothesis, whereas a research would generally have a specific hypothesis. So those are just some ways of thinking about the difference between the two. Both are equally valid, both are equally important as far as how we do our work in public health. It's just the aims are slightly different between the two. So hopefully that's clear. And in talking a little more about the similarities between evaluation and research, both of them use primary and or secondary data collection. By primary data collection, I mean data that you collect either as a part of routine process in evaluation. So maybe you already are charting things or you're keeping track of something in some other way, but you collect the data. Often in research, we have to go out and seek that data. We can conduct surveys, we can do interviews, we could abstract data from electronic medical records, which would be considered primary data to a certain extent if the way in which we're doing that is of our own construction. Secondary data would be data that already exists, has already been sort of curated and managed to a certain extent, and you're simply looking at it with a different research question or with a different aim than its original intent. And so there are a number of surveys out there, like the one I was showing you briefly in terms of concussions. That is a secondary data source that I am attempting to answer a research question. If I wanted to be really rigorous about it and ambitious, I would try to collect my own data and maybe set up a situation with multiple hospitals where I'm going to actively, prospectively collect data on concussion injuries. That can be super tedious in the sense of labor intensive, a lot of negotiations to get that data. And not to discourage anyone from doing primary data collection for research, but it can be something that requires some funding, some manpower, and some additional resources that may not be realistic to do primary data analysis during your Master's of Public Health career. So both research and evaluation use qualitative and quantitative methods. The distinction on that I will make shortly. Some people are really comfortable with the idea of qualitative versus quantitative, others struggle. Some of us are oriented more towards quantitative analysis, others towards more qualitative methods, or there's also something called mixed methods. But my main point here is that both evaluation and research use those types of approaches to research. Usually some kind of statistical analysis is done in both evaluation and research. Definitely in the case of research. In the case of evaluation, there could be something like a process control chart. If any of you have done projects in continuous quality improvement, or maybe even if you've done, let's say you kept a log of your physical activity or something like that. That's kind of like a process measure that you're keeping, where you're putting in your daily information on how far you walked or something like that, or some sort of dashboard. So that's also a form of data collection, and usually you're doing some sort of analysis of that. You could do graphs, you could do charts, you could do formal statistical tests. You don't usually do that for our own personal health data, but you get the idea that there's some sort of analysis that happens in both settings. And really, our goal with both evaluation and research is to make decisions. And what we do is we set up in advance, what are the rules that we are going to use to make decisions? What level of evidence will we need to say, oh yes, let's implement this new practice because it works better than before? So in advance, it's important to establish what would be that criteria. If in the case of the example that I gave a moment ago about medication expiring, you may say, well, if we can improve our rate of expired medications by 10% per quarter during the period in which we observe it, it would be worth implementing a system-wide change or a change and do some training and implement that change, because there might be some costs to doing the intervention. So you might set up some of those rules in advance. Likewise, in a more researchy kind of context, we would want to say in advance, okay, well, what kind of effect would we need to see of, let's say, a drug compared to, say, a placebo? What would be the difference in effect? Or let's say a new drug compared to an old drug. What would be the difference that we would need to decide that this is in fact better than the other drug? The way that actually works in practice is all you have to do is show that it's equal. You don't have to show that it's better, and you can take that drug to market. But that's a whole nother side conversation. Ideally, if it's a new drug, it should do better than the other one. But the way it works is that it only has to be as good as. So that could use some work. And both have very specific standards on quality of evidence. And a lot of that has to do with the same factors that I mentioned when you're assessing a journal article. What was the study methodology? What were the measures that were used? Those kinds of things. Okay, so I realize there's a lot of content here, but I wanted to address this because in your write-ups of the documentary narrative, your research, the questions that I asked you to create for a questionnaire, pretty much everything we've done so far, a lot of you have been kind of framing it as a research project, which is great. I'm really excited that you're all thinking that way, because we need people who want to do research. And I'm also really impressed how so many of you are being sensitive to the fact that we need to protect confidentiality, privacy, obtain informed consent, all those things that many of you already seem to be aware of, which is great. And one difference between evaluation and research is that sometimes people who do evaluation don't think that they need to be as rigorous on the ethics side, that it doesn't need to go through IRB, that it doesn't need to have the same sort of protections as research. And I avoid making that distinction. You will see that in other textbooks and other places where you say, well, evaluation, you don't need IRB approval for. That is not true, especially depending on the setting you're in. Really anything that you're doing with patients or with community members, ideally you're doing some sort of informed consent. So I'm glad to see that everyone's instincts are in that direction already, because it really is important to assure people that the information they're providing is going to be confidential, and not just personal health information. So some of that's protected by HIPAA rules anyway, but even just in terms of other information, like demographic information or opinions about health states or health attitudes, those kinds of things, which aren't considered personal health information, it is important to protect those things. Okay, so I kind of talked about some of the goals of evaluation. You may be looking for specific needs, gaps in your services. And again, this is very general. I'm not talking about hospitals necessarily, any kind of agency that you're working in or any setting. You're looking to say, what are we missing? What can we do better? Etc. Okay, so I'm going to skip through a little bit of this and move on to what it would take to set up a research question in the case of research, and what would be a good goal statement in the case of evaluation. And when we do these types of projects, we should always think about modifiable targets in terms of things that we're looking to research. It should be something you should be able to change. If you were simply going to say, I want to do an evaluation of our patient population and the patient mix within our population, or something that's purely descriptive, that's really not something that's modifiable, nor is it terribly interesting. Usually it's something that it might be interesting to you, but it's not really research and it's not really evaluation. So there should be something that is modifiable, even if it's not necessarily under your control. It's also something that has to be measurable. And so you don't want to say something simply like, we seek to improve outcomes. Well, what do you mean by outcomes? So like you should be very specific, and it should be something that is concrete and measurable. And there should be instruments that are either already developed or that you plan to validate to measure specific endpoints. And most importantly, when we make statements about research questions or goal statements, they should have a who, a what, a when, and a where within them. The who is the target population. Who are you serving, or who are you targeting with the research? And by that, I mean, basically, who is your study population? What is the main purpose of the study or the evaluation or the intervention? When, so for how long will this be going on, this intervention, or how long you'll be following people? And where, what is the setting of this research? So let me give you an example of a couple of statements. One will be a research question, one will be a goal statement in the context of evaluation. Okay, so a research question might be, and this one is about the relationship between infection with HSV1, which is a herpes virus that almost all of us have. HSV1 is the one that causes cold sores. Don't get caught up on the research question, although it's an interesting research question. But the question is, we sought to determine if latent infection with HSV1 was associated with risk of Alzheimer's disease in a cohort of middle-aged adults residing in the community, followed prospectively for 15 years. Okay, so that's an example of a research question. Now, a goal statement that's similar, or it's also focused on Alzheimer's disease, is more about a specific program. And in this case, we have, oh gosh, this is covering, sorry, this little bar was covering the statement. We sought to decrease perceived caregiver burden and strain among Alzheimer's caregivers in our healthcare system through enhanced screening for depression and increased referrals to a caregiver support group within 6 months of diagnosis. So diagnosis of the person that they're taking care of. Okay, so in the first context, we are trying to create new scientific knowledge about a potential association between latent infection and Alzheimer's disease development. In the second one, which would be an evaluation type setting, we are simply trying to expand services to a group of caregivers. And our goal is really to make sure that they each received screening and referrals to caregiver support. That's really what our outcome is there. And so the orientation of the two questions or statements are different because one's generalizable knowledge, one is for a specific program. But what they share in common is both have a who, what, when, where. And I'll show you exactly where that plays out. Oops. Okay. So I put in color coding here, the who, the what, the where, the when. So in the research question, we sought to determine, that's just words, if latent infection with HSV1 was associated with risk of Alzheimer's disease. That's the what. That's really the core hypothesis would be that being latently infected increases your risk of Alzheimer's disease. Where? This is a community-based study, so people residing in the community. This isn't a clinical population. This isn't a select group of patients who maybe already have pre-dementia or something like that. It's just basic middle-aged adults. And that's the WHO, it's the middle-aged adults. And then the when is we're going to follow them prospectively, meaning forward in time, for 15 years. Okay, so that is an example of a good research question and that addresses the who, the what, the where, and the when. Okay, so the same structure should apply to an evaluation statement or a goal statement within an evaluation. So the what in that case is we sought to decrease perceived caregiver burden and strain. Okay, and implied there is we're going to use some kind of very brief survey. Maybe it's 5-6 questions asking respondents to talk about their stressors or their level of stress. Okay, so maybe you do a quick little baseline survey, ask them, do you feel, financial strain? Do you feel psychological strain? Do you feel physical strain? Okay, there could be different types of strain and different types of burden. So maybe you do want like a dozen questions or something like that, but very specifically focused on that issue. And then you would implement this new, I'm sorry, that's the what. Okay. So the implicit hypothesis is that caregivers are experiencing this strain, and if we do this intervention, that will improve. We can diminish strain, diminish burden. Okay, the who is among the Alzheimer's caregivers. In our healthcare system, that's the where, and that's kind of where this becomes more of an evaluation type project in that it's specific to this healthcare system. And then the when is within 6 months of diagnosis. They're going to get those referrals. And I should have probably highlighted more of the white portion of that one in green, because the what is also kind of what the intervention is. Okay, so so those are just 2 examples, but both are good examples of where we have addressed those questions, and it becomes very clear to someone who's reading this, whether it's a funder or other scientists or anyone whose business it is to allow us to do something, what it is that we intend to do. Okay, so those are just 2 examples. I was going to make this your writing assignment for this week. I went easy on you this week. But writing good, effective goal statements and research questions is a good habit. So if you ever want a good mnemonic, the who, what, when, where, as long as you've answered those questions, you're probably in good shape. Okay, so back to goal statements. So, and being measurable. So a goal is any measurable statement about the intended outcome of a project. And that's the overarching goal. So in this problem statement, and the goal statement was we sought to decrease perceived caregiver burden and strain. That is the goal of this intervention, okay? Objectives would be the specific and measurable steps that you do to achieve that goal, okay? So these can be thought of as sub-goals within evaluation. In research, we often have sub-hypotheses or maybe alternative versions of the main hypotheses. So that might be kind of the equivalent within research. But in evaluation settings, we usually have goals and we have objectives. So in this example, perceived caregiver burden and strain is our overall goal. Our objectives, which we could also measure, would be how many did we provide enhanced screening to? How many are for depression? How many referrals did we make to caregiver support pre and post intervention? And so those are kind of objectives to meet the overall goal of decreasing caregiver strain. Okay. I'll give you another example of the difference between goals and objectives, because it's sometimes when you're asked to say what are my goals and what my objectives are, you're like, well, what's the difference? So I'm going to give you another example. So if we're doing an intervention, and this is a little old now, but we're doing something on Zika virus. Okay, so let's say we're at a international health clinic, or just let's say an OBGYN facility. And we seek to provide expecting mothers and their partners with information on the risks associated with travel to Zika endemic regions and increased knowledge of use of protective strategies both when traveling and upon return. Okay, so I don't know if you recall when Zika first emerged, there was a lot of concern because of the potential for birth defects, and there still is that concern, of course. And there's also concern among travelers because it actually can be sexually transmitted. So there would be some counseling that would need to be done, both with the expectant mother and their partner. Okay, so that's the overall goal. Objectives might be kind of sub-aims. How are we going to get to that objective? So we would provide, and these are just examples, provide CDC's educational materials to all women of childbearing age, regardless of their pregnancy status. Really easy to do, just a piece of paper or an email that goes out. Among all patients who are pregnant, use a screener to determine if the patient or the spouse partner has or will travel to an endemic area. So this might have been something that a hospital or other setting, it could be Planned Parenthood, it could be somewhere else as well. But they might want to implement this new kind of screener to say, hey, we should probably give more intensive information to this person who may have traveled. Screen all male patients regarding recent travel to endemic areas and advise them on risks of sexual transmission to partners. So, so let's say we have a patient population at Kaiser or something like that. When Zika was first emerging, perhaps we would make it a policy if the patient all patients would be asked, did you recently travel to any of these countries? And if they said yes, then you would advise them on the risks of sexual transmission to partners. And then for those pregnant women or their partners who plan to travel, provide recommendations on bed net use of repellent, and a checklist for housing to avoid exposure. Okay, so first you tell them about the risks, but then you also say, well, if you are going to go, then you'll want to get a hotel that has air conditioning and screens, and that will minimize your risk of exposure, or maybe other factors that they would want to consider as they're making a choice to take that risk or not. Okay, so those are some examples of goals and objectives, and I wanted to kind of clarify the difference between those two. Okay, another thing that we do in evaluation that we don't do as much in research, unless we're talking about community-based participatory research, which is more like evaluation because it is about a specific community, is that we involve what we call stakeholders. I'm not crazy about the term, but these are people who have an invested interest in the outcome. And by invested, I just mean that they're part of the community, or they are affected by a decision that's going to be made based on your evaluation. So this is really specific to evaluation. And when we decide who we're going to bring to the table, there's a couple things to consider. I mean, obviously getting input from multiple people from the beginning is really important. If you want to implement any kind of project, implement an intervention, do an evaluation, you really need to get buy-in from different levels of the organization. And this is important because there are some people within an organization or a setting that may have what we call low power and high legitimacy, which means they don't have a lot of say in what's going on, but they know what's going on. They're the people who work every day in the setting. They're the ones that are going to actually have to do the new work that's involved. If you're implementing a new screening program, you're implementing a new process for dealing with drug management, you're doing a new infection control strategy. So we call them high legitimacy because they're the ones who have the most kind of local knowledge, day-to-day knowledge of the goings on. They could probably tell you everything you want to know about what happens. So nurses would be a good example within a hospital. They tend to know everything that's going on. Doctors are a little more aloof on average, no offense to the doctors in the room, but they may not necessarily know all the ins and outs of all the different things that have to happen within the setting. I don't mean to pick on doctors, but that's just an example. Patients would be an example of having relatively low power, but high legitimacy. They're the ones that are experiencing the intervention. Community members, program and support staff, frontline workers, the recipients, which would be similar to the community members, but these would be people who actually receive the intervention, family member, elders in the community. These are just some examples of folks who have a lot of local knowledge or understanding of what's going on, but don't necessarily have a lot of power or a lot of say in what happens. So you definitely want to include people from that group. You can have one representative from each of those, but it's one way to think about who do I invite to the table. The other side of the room, hopefully you mix people together, but conceptually, the other side of the room, you have policymakers, funders, members of an evaluation team, academic partners like me or you, administrators, politicians, government agencies, non-government organizations. So those, the people who have power, or at least are the ones who are kind of putting the intervention in place or not. They kind of make that decision. So a hospital administrator or city council or whoever's head of the organization that oversees that particular health issue, they're the ones that are making these kinds of decisions. So they have a lot of power. They have relatively low legitimacy especially from the perspective of those who, the bulk of people who are involved in the project, the bulk of people who will participate in it, the bulk of people who do the day-to-day work. And so you want to have both groups involved in any kind of evaluation project that you're going to do. Because if you don't get that level of buy-in, there's some sort of Ghostbuster situation happening in the back here. I don't know what's going on. There's heavy cleaning happening behind me. I'm very sorry about that. You may see it in the background. There's like a backpack involved and a crop duster. The low legitimacy, high power folks, these are the ones that are going to be doing the make the decisions. So, what I was saying was the importance of getting the low power, high legitimacy folks is you will not successfully do an intervention or evaluate an intervention if you do not get their buy-in. Okay, imagine an overworked staff member or nurse or anyone else at a facility. The last thing they want to do is add something like a screener or a research component to a project. Some will understand the importance, others may not. And so you really may have to do some education around why it's so important, how it could actually improve their day-to-day work, how it will actually improve patient outcomes, how, and I'm focused on clinical settings, but you can imagine for any kind of organization. And so the goal is to educate and inform, so that, and also to get people who are advocates for your project within a setting. So if you can get buy-in from, not just the head nurse, but also other people on the floor, or if you want to get buy-in from community members, not just one community member, but different organizations, it's going to be a lot easier to get your work done. And that may seem obvious, but you'd be surprised how often people go into settings thinking, okay, well, I got approval from one person to do this, or I got approval from the head of the hospital to do this. And then they get there and no one else has heard about it. No one else wants to do it. And it's not successful just because of lack of buy-in. So do not underestimate the importance of getting kind of a coalition of interest in doing whatever it is you're doing. And I'll just share a quick example. I did a intervention on an acute care, acute psychiatric ward, where the nurses and doctors were doing okay. The people who are not doing okay in that setting and were having a lot of worker strain, were feeling burned out, there's a lot of turnover, and patient outcomes weren't great because there's a lot of fighting going on, there was a lot of disturbances, there were a lot of kind of lockdowns and things like that. And so they asked me to do an intervention to try to minimize that occurrence of those kinds of situations that were the most stressful. And in talking to the different layers of employees at that acute psych ward, I realized that they all had very, very different perspectives on what was wrong. The commonality was that there was a lack of communication across different shifts. So nurses who left at, let's say, 11 o'clock, they didn't always tell the nurses who are coming in at 11:30 or 11, I'm sorry, starting at 11. There was no real formal way to communicate where patients were in terms of their elevation status, like kind of where the whole mood was as an individual and then as a collective unit. And so across the board, social workers, support staff, and all of them really felt like the communication was the biggest problem. The only people who weren't aware of that were the doctors who did the prescribing. They were generally seeing the main problem being the fact that they were receiving a lot of very highly acute psychiatric patients. Sometimes they were taken straight, from an incident or something like that. But they were not aware of the communication problems that were occurring among staff. And so I think if I had only gone in and talked to the doctors, I would have had very different recommendations for some sort of intervention than if I had not talked to literally every person who worked in that setting. So what ended up being the intervention was they basically had a little like abacus-like thing in the nurses station, but everyone had access to it. And you could basically put each patient, they didn't have a name on them, but it was just like by room, essentially. But you didn't have a name on it because you didn't want the patient to know. And at the end of the shift, they would put the abacus or the little thingy where they thought the patient was in terms of their kind of elevation level. And you could look across this visual thing and see, okay, where are the individuals? And as a group, where is it shifted? Is everyone agitated? Okay, are we like in this potentially high risk situation where there's going to be a lot of disturbance, or is it just one or two patients who are maybe slightly agitated? And so just this very simple intervention allowed all staff to kind of update where the whole situation was. And that may have felt good to do at first, but then the question is, did it make an impact? And that's the hard thing to do, to say, okay, well, what is this? How do you measure this over the long term? And we did see mostly in terms of the strain on the employees and their perception of control over the environment, which is a big part of your own mental health. If you don't have control over your environment, you're going to be stressed out. And so it did have mostly impacts in terms of the staff's well-being. It didn't necessarily have as much of an impact in terms of the noticeable number of incidents that happened per month. So those seem to be different issues, but it did have an effect, at least on the perceptions among staff and their sense of strain. There are all kinds of things that you can do like that in different settings. Okay, I'm going to skip logic models, because logic models are ways of representing what you're going to do. Very similar to systems thinking type models. So I will share one real quickly. So if we're looking at to do a tuberculosis control effort, okay? So at the top we have, what is our purpose? What's our mission here? And in this case, it's to improve health and well-being by a collaborative effort to reduce the incidence of tuberculosis. Okay, we don't talk about tuberculosis a lot anymore in this country. It is still an issue, but let's pretend we're in Bali, in Indonesia, where tuberculosis rates are very high. Okay, so then we identify, okay, well, what are our resources and inputs? We've got staff, we've got health information systems, labs, an organizational structure, and then we also identify what are our constraints and limitations. We have fear and stigma listed, limited clinic hours. So we look at our kind of strengths and our weaknesses. Then what are the activities that we're going to do? So in this case, we're going to do patient identification, contact tracing, and doing kind of root cause analysis of any local cases. So those are going to be our new enhanced activities to deal with tuberculosis control. Okay, better case finding, better contact tracing, and looking at underlying causes. And then the things we're going to measure as kind of short-term outcomes, the number of persons completing treatment, the number of people beginning treatment. These are kind of intermediate goals. And then the long-term effects, cure rates, reductions in the overall tuberculosis rate, and improvement of health status. Okay, so a logic model is a good way to kind of just break apart the different components of what it is that we're going to do. And you may say, well, duh, you know, but it really does help to get these things on paper. And you could also, when I was talking earlier about getting buy-in from different people within an organization, having a visual guide like this can be really helpful. You say, okay, this is what we've got, this is what we're going to do, this is how we're going to measure it, and this is how we're going to really determine whether what we're doing is having an effect in the community. That's a lot more compelling to someone that if you make them read some article about tuberculosis or something like that, or you do a 2-hour PowerPoint presentation on tuberculosis. It's a relatively easy way to explain to someone in a visual form what it is that you're going to do. So it's kind of similar to some of the systems thinking models that you guys created, but this isn't more in the context within a very small setting, what it is you're going to do. Okay, some other suggestions for doing evaluation. have a very detailed timeline for what when you're going to implement those different components. You want to clearly define the roles and the steps that you're going to take in doing the research, or I'm sorry, the evaluation project. For both research and evaluation, you want to include a pilot or training phase. This is really important. So when you guys wrote your questions for the demographics, I would always just circulate that questionnaire or whatever it is that you're going to use among a group of peers. They can spell check it for you. They can identify logic loopholes in it. Look, I made little comments on your your surveys as far as, maybe you should have an other category for this one, things like that. So it's always important to pilot any kind of instrument that you're going to use. Hopefully you're using something that was already previously validated and is known to be a reliable instrument. But often we do find ourselves having to create something for a local setting. And so always do pilot phase, and also allow time for training people to actually implement an intervention. At first, when you're implementing any kind of program, you want to focus on program fidelity, which means you want to look at, am I doing what I said I was going to do? Or am I doing the way, if I'm repeating an intervention that was done somewhere else, am I doing the program with fidelity? Meaning, am I doing it to the letter of the protocol? And so you want to do some kind of evaluation early on to say, are we actually doing the intervention? This isn't the stage of, did the intervention work? It's, are we actually effectively implementing the intervention? And that involves having written policies and procedures. Okay, so hang in there, just one more step. Then I want to get to just do outcome evaluation. There are different types of evaluation that can occur. There's process evaluation, which is kind of the fidelity piece. There's outcome evaluation, which is quantifying the change between baseline and follow-up. So in the case of the caregivers, where was their stress level at baseline? We focused on improving referrals. We focused on doing screening for depression. Did that have an effect? So at 6 months of follow-up, what is our change from baseline? That would be an outcome evaluation. Where were they at baseline? Where are they at 6 months? Okay, and usually you want to have one main outcome. In this case, caregiver stress or strain. You may want to build in some secondary outcomes that are either interesting or they assure that you are able to capture what you were intending to capture. So you may have something that's similar to the main endpoint that allows you to see, maybe you didn't achieve your goal of decreasing strain, but maybe you increased their knowledge of resources. Maybe you increase their willingness to participate in a support group. So you often want to implement 2 or 3 outcomes in an evaluation. Not so much to hedge your bets, but especially if you're going to bother to collect data and to do an intervention, you want to be able to see if there's at least some kind of signal that what you're doing had some effect. So if maybe your outcome measure was too ambitious, maybe you weren't necessarily going to have this huge impact on their sense of strain, but maybe you are getting people to this sort of like more empowered state where they feel like they can start to get some support or access to support or know where they would go if their depression got worse or something like that. Okay, and so in my example of working in the acute care setting, acute psychiatric setting, I had both big endpoints and short-term endpoints, which or intermediate endpoints though we didn't hit it on the big ones, which was the number of incidents that occurred on each floor, we did hit it on the more intermediate ones, which for some participants in the project were the more important ones, which was the staff perceptions of strain. And their main concern was, staff turnover, staff burden, their mental health, all those things. So from their perspective, that was actually more important than the main outcome. So always build in multiple endpoints. Okay, I will wrap up. And there are a few more slides that I will, if you want to go back and use this as a reference, if you're considering doing evaluation work in the future. But I just wanted to make it clear that not all public health work is doing research, and you can also do evaluations or implement smaller projects. You can do needs assessments, you can do look at some sort of short-term process and see if that has any kind of effect. So it doesn't always have to be this long follow-up, takes 2-year research project. There's a lot you can do on a smaller scale. That project that I mentioned with the acute psych ward, I did that over a 6-month period. And so that's a more reasonable thing for an MPH student to consider doing. And if you're not already at a site, I bet there's a site near you that says, gosh, we've been meaning to have someone to come in and help us with this, and we just haven't had the time to do it. Could you do it? So that's just some suggestions for getting involved in that kind of thing. The primary difference between research and evaluation is the intent. So are you trying to create generalizable knowledge, or are you simply trying to determine whether a local program is working? Both evaluation and research are subject to HIPAA rules. So our goals of protecting confidentiality and patient information that you collect should be equal across these two types of activities. As I mentioned, evaluation activities don't always technically need institutional review board approval. However, I would recommend highly that you ask before you start to implement anything, whether your project needs IRB approval or some equivalent to IRB approval. National University, I'm relatively new to National University, so I do believe we have our own IRB, but you'll learn more about that in your research methods course. But more likely it would be at whatever setting or wherever you're placed as far as IRB. And then finally, both evaluation and research share similar methods. So there's no reason that evaluation should be less rigorous than research. You should still use the optimal method for the research question or the evaluation question. It's not like research is more fancy or more sophisticated. It's usually just the nature of the question that's different. So both of those require rigorous methods. Okay, so that was a lot, I realized, but I wanted to make clear because some of you may be intimidated by the idea of doing research, and I just wanted to make it clear that there's this whole other area of evaluation. So I have 1 minute for questions. Any questions? All right, well, I timed that well, didn't I? Didn't leave like 10 minutes for questions. Really glad. Okay, well, that is our course. As far as you interacting with me, feel free to set up a time to meet outside of class to just more informally discuss some of your goals within the program, your course of study, anything you're interested in, research ideas, evaluation ideas, whatever it is that you'd like to discuss. So thank you very much for your attention. And once again, thank you for taking the time out of your busy schedules to listen to me talk for an hour. And I hope you guys enjoyed the course, and remember to fill out that evaluation as soon as you can. So thank you.
Thank
Thank-
you.
Bye.